Welcome to Ripple Effect Connection. I'm your host, Christy Hugic, and I'm so glad you're here. Thanks for stopping by. Thyroid health affects millions, with an estimated 20 million Americans facing thyroid disease, and nearly 60% may be undiagnosed, according to the American Thyroid Association. When I polled all of you recently on Instagram, hands down, thyroid health was the topic you wanted to dive into the most. So we're here to cover the essentials, from root causes and lab insights to food-based solutions for thyroid support. In today's episode, I'm joined by my friend and colleague, Kelly Troup, a functional medicine nutrition practitioner with a deep understanding of thyroid health and imaging. Kelly's journey into functional medicine began with her work in ultrasound, studying the nuances of anatomy and physiology. Her own path to healing, overcoming metabolic disease and later becoming a primal health coach, fuels her dedication to helping others through a holistic approach. Together, we'll explore conditions like Hashimoto's and Graves' disease. We'll discuss the considerations around thyroid removal, and we'll offer insights for optimal thyroid health. Welcome to our Thyroid Deep Dive with Kelly Troup. First of all, if you haven't checked out the episode from Season 1 with the one and only Kelly Troup, please do so. But I am honored to welcome you back to the podcast, Kelly. Thank you for coming back.
Yeah, thanks for having me. I'm actually kind of excited to nerd out. I mean, I like to nerd out on nature, but I mean, labs is like close second, close equal maybe.
That's what this podcast is all about. I bring all my friends who nerd out with me on the podcast to nerd out with you all. Some of them are probably like, wow, they're really nerdy. And some of them are probably like, wow, this is kind of interesting. But yeah, we're our own special kinds of nerds. So we requested topics. And one of the biggest topics that came up from people who wanted to hear topics on the podcast was the thyroid. Because I think especially females, even though males can have thyroid issues too, it happens to a lot of females. Let's give them a basic. So 101 out there. Where is the thyroid located, and what are the functions of the thyroid in the body?
All right, so the thyroid is an endocrine gland that's right in your neck. You've got a lobe on each side, and then what they call an isthmus that connects the two sides. So it looks kind of like a butterfly. What I tell everybody is the endocrine system is a whole system. So everything that happens with your thyroid affects your other hormones, whether it's sex hormones, maybe your stress hormones are affecting your thyroid. Even going to leptin, which most people realize is like a fat-burning hormone, actually kind of tells your thyroid what to do sometimes. So even the hormone that's leptin can control your thyroid. But basically, the thyroid is a regulator of your metabolic rate. It kind of helps with calcium too. There's some parathyroid glands that can regulate your calcium levels too. But your energy, your digestion, your temperature of your body, your heart rate, even somewhat of your cholesterol, like all these different things are connected. Reproductive health, growth, weight, all can be sometimes linked back to the thyroid.
Yeah, and I mean, I always say it's a small gland with a big, packs a big punch, because it is connected to almost everything. And that's why I think in what we do, we are always looking at things as a whole, why it's important to look at things not just isolated. A lot of doctors will get into labs in a sec, but TSH alone is not enough. So we're going to get into that. But I think out there, and some people have this, so they know the difference and know what it is. But for those who don't, or maybe go undiagnosed, which is also possible, hypothyroidism versus hyperthyroidism. Explain the differences in those and the symptoms of each of those.
Yeah, so most people know about hypothyroidism, right? Because they're like, I don't think my thyroid's working well enough. I'm tired. I've got brain fog. I'm cold all the time. My extremities are cold, or I'm gaining weight. And the first thing they want to do is look at the thyroid. So I think most people are more familiar. Maybe you're constipated too. That's another common one. Or your mood's not as great, or your libido's not as great. A lot of times, yeah, we're looking at the thyroid for hypothyroidism. And what that is that maybe it's underactive. The problem is that underactive is a very basic label. And when we kind of talk about labs, we'll elaborate on that, right? Like underactive might not be because your thyroid function is low or not working, that maybe you're having trouble with things downstream that's causing you to feel hypothyroid. But again, we can get into that. Hyperthyroid is maybe something we see when your thyroid starts to get attacked or there's an autoimmune response, or maybe it's in a hypersense because there's infections or something going on where there's like a cascade of events and the storm happens in your immune system. So at that point, doctors really get worried because the heart rate can really increase, and there's things, where like your eyes can start to bulge, and like you can have a lot of symptoms that, can cause you to maybe even die. So a lot of times they want to kill off the thyroid when it gets into that state. In functional medicine, we're not usually trying to kill off the thyroid if it's manageable. So it's something that needs quick action for sure. So there might be some things we have to do to suppress that, symptom while we're working on the root cause. But I'm a little apprehensive to kill off the thyroid right out the gate these days. I'd rather work on the root cause problem, see if we can calm inflammation down, things like that. And some people can actually oscillate back and forth. You can be hypo and then go into a storm and end up hyper too. So thyroid labs can change very quickly, very, very quickly. So sometimes what I tell people too is I almost want serial blood work on this. They're not expensive labs. I would love to see them, maybe 3 times in 1 month because they can change so drastically. Like I've been stressed and I've seen my TSH go to hypo, and I just happened to run it a week later because it wasn't a full panel. And I'm like, no, we're running this again. And my TSH was back within range. And so some people don't get to see that correlation with their labs. But when your thyroid's hyper, I mean, it can affect your mood. It can affect your heart rate. You can sweat a lot. You can be hot. You can, feel like you're getting hot flashes. Your skin and hair can get thin. You can almost have frequent bowel movements, although sometimes people don't always correlate that with their thyroid. And you can almost lose too much weight where you're having trouble keeping weight on too.
Yeah, and what if people actually have a label on it, like a Hashimoto's or a Graves' disease? Talk about those different terms how do you get to that label, and what is happening when you actually get that quote unquote diagnosis?
I like to say that you've been welcomed into the autoimmune disease group. And, and again, like we said, it can switch, but usually if you're hypothyroid, you have Hashimoto's. You might not have even got the label yet because in the time slot where they checked your thyroid, maybe those antibodies didn't present themselves. But that does not mean that maybe there was an attack in the past where now your thyroid's a little slower because it attacked itself, got some nodules, got some irregularities, things like that can affect function. But yeah, to have an autoimmune disease, and I will tell everybody this till I'm blue in the face, we have to have some factors. We have root cause things going on. You almost always have a pathogen of some sort, whether it's mold or Lyme or parasites or extreme gut dysbiosis or, maybe an H. pylori infection, something that's putting the immune system into overdrive. And then you combine that with a leaky gut, which is usually secondary to having a big infection, and now it's letting things into the bloodstream. Whenever you have that leaky gut, you're prone to your thyroid being attacked. There's a lot of foods that look like your thyroid. So wheat, potatoes, any grains, chocolate, eggs, dairy, like you're eating these foods, your body's like, oh my gosh, that's not supposed to be here. And it's trying to get rid of it. But in the process, it looks so similar to your thyroid that your thyroid starts to get attacked too.
Yeah. And so each of those conditions, when your thyroid's underactive or overactive, there's going to be natural medicines and food medicines for each side of that. And sometimes one can be detrimental to the other. So you have to, kind of have the right food medicine. So what are some things that people can do from a natural food medicine standpoint to help each condition?
I'm not even going to say each condition because obviously the key is going to be let's figure out what's causing an overimmune response. Let's try to calm the gut. Let's just try to work on the deeper things, and let's give the thyroid nutrients it needs to thrive. The thyroid's always going to need the same nutrients, even no matter what state it's in, and even calming the inflammation helps both sides of the coin there. So the first thing that I always like is iodine, and people will want to punch me in the face for saying iodine because I can throw somebody into a storm. I agree. I don't want you to go buy a supplement. It's the last thing I want you to do is to take an iodine supplement that might be 3 times the amount that you would get from food. I'm talking like kelp flakes or kelp noodles or some sea vegetable that maybe you have once or twice a week, because iodine is just like anything else. Too much is a problem, but too little is a problem because you actually really need iodine for your T4. It's a whole thing. Everything works together. And so some people want to chastise it because they're like, well, that can throw you into hyper. Yes, but if you don't get enough, you're definitely going to hypo. So we need that magic in between. I also think the thyroid loves minerals. So a lot of times I'm like, hey, you don't necessarily have to bring in a desiccated thyroid support, but like beef liver or something like that, that's going to have copper and vitamin A, that's going to help your thyroid out. It's going to have B vitamins, zinc, all these different cofactors. Eating foods with selenium, so some of your shellfish and stuff like that, those are all things that help the thyroid. And then even, we talked a little bit about the desiccated thyroid. The reason why it works so good is because it has all these minerals that your thyroid need. It's literally the bovine form of an animal, and your organ stores everything it needs, and so does theirs. So a lot of times I can have somebody on thyroid meds and I can bring in that desiccated and see a game changer in their labs. Or sometimes I don't have somebody on meds and we bring that in and they don't ever end up needing the meds. So really, wherever you're at, we can work with it. And every case is going to be bio-individual. But desiccated thyroid is something I will probably always take. I know that I've had injury. I've had on this side a spot that's a little weak. If I stop taking it, my N1 is my nails aren't growing, they're breaking off. I'm like, this is crucial, and it's, again, things happen where it's like, just support it. Food-based medicine is always top tier in my book over a supplement. I use supplements. I need them sometimes to help your body rebalance, but food is king all the time, because I think there's cofactors in there that help your body utilize those things more. So that's usually where we start when it comes to supporting the thyroid, whether you are diagnosed with thyroid disease or not. Getting food medicines in, like the iodine-based ones, and even just the beef liver that can support multiple organs in your body with minerals and, bioavailable nutrients is going to be key.
Yeah, and I mean, you all are the ones that got me to start eating sardines. I was not a sardine person. I thought it was a big deal, but I think getting those sardines, in here and there a couple times a week is always helpful. I love the seaweed snacks that you can get, the organic seaweed snacks. So all of those are helpful for the thyroid. And then oysters, right? Am I right on oysters? Oysters and mussels,
Yeah.
right? Those are good ones for it. So those are like some things to incorporate, I think, just for general purposes, like Kelly was saying. Kelp is big, which the other thing I wanted to say is I can back up what Kelly said in that, from a toxin or different toxins, I definitely was showing some signs of my thyroid being, there were some antibodies present, numbers were off, my T3 was off, and I took a very good supplement for quite a while and it did not move the needle. And so sometimes it's not about the supplement, it's about what your body's able to absorb and is receptive to. And like Kelly said, I seem to respond to the thyroid glandular myself. Well, ever since I started taking that, I've seen my thyroid increase. So I used to be super cold all the time, always cold, and or would have not hot flashes, but just feel a general sense of warmness also. So it was one extreme to the other, which kind of was a sign that maybe things were off. So what Kelly said, I can totally vouch for, in that some of these supplements, they can be very helpful, and we just need to find out what's best for you. But you can get support from a natural standpoint without the pharmaceutical interventions every time. So you mentioned testing. How often do you think the thyroid should be tested and looked at with blood work? And I think that it's going to vary, right, too, because we see these people on these thyroid medications and they're not necessarily getting tested regularly to know if those medications are working.
No, and they're likely not working on the root causes either, so there might not be a ton of changes. But yeah, usually it's somebody starts getting symptoms and they're like, oh, we better rerun these. And it's like, well, obviously when they vary that much, I mean, I would love them, like every 3 months if somebody's on a thyroid medication. If they're on the more natural stuff, maybe we can spread it out to twice a year, every 6 months or something like that, because we're working on root causes and obviously that's going to take some time. But obviously paying attention to your patient and listening to symptoms is really going to help you guide. So it's hard to be like, oh, do this guideline. I'd be like, I want to check in with you more often. So if I can see that alarm going off that there's something going on, then we can run them again. And it's not a bad place to start because, like I said, your metabolism is key to life on a lot of levels. So it's definitely an important area to check, pretty often, I think.
Yeah, and especially when you're starting something new, you would want to see that, fairly soon to see if how the body is responding to that. So let's talk about these markers, because I was on a rant not too long ago on Instagram because I have a good friend who was dealing with fatigue. Literally only tested her TSH and her T4, I believe, and that was it. So let's talk about the markers. When you're asking for a thyroid you want to know how your thyroid is truly functioning. What are the markers that people should be asking for from their doctor?
So the doctors are going to push back. So that's first and foremost. So just expect it going into the conversation. And it's just because they don't understand the gland. So sometimes you're going to have to be your own advocate or go to somebody else that can order them that does understand your thyroid. So there's optimal, like I would love to see them all because it paints a picture. But if I can only get a few, there's a couple that I would definitely prioritize. And that's always going to be your TSH, because I do want to know what signal your body is sending to your thyroid. So what I tell people is the TSH comes from here. It comes from your pituitary gland. It's not indicative of what your thyroid's doing. It's indicative of what your body thinks it needs. So it sends a signal here and tells the thyroid what to do. What your thyroid generally makes is probably a little bit of all the hormones, but the T4 is its primary one. So a lot of times I'm looking at the T4 like, is that low? Is that high? You know, where is that in the range? Because that's telling me what the thyroid's actually doing. So if I'm seeing chronic labs where that T4 is off, I'm like, you need to go have an ultrasound. You need to have that go looked at. Maybe there's nodules. Maybe there's things from years of, things happening that you didn't know about, because sometimes we miss the subtle signs. So it's not till they're screaming at us that we actually start to change or do something different. So T4 is here. And then we go to T3, right? So T4 has to convert to T3. It needs a pretty decent gut health situation for that conversion to happen, a pretty good liver health conversion. So if your detox pathways are slow, that can prevent the conversion from being optimal. And it needs some nutrients like we talked about, right? So you need nutrients, you need liver health, and you need gut health to get that T4 into that T3 form. So T3 is what your body's looking to grab onto and to put into cells and actually utilize. So you can have a perfectly great T4 and a perfectly great TSH. And I guarantee you that 95% of you have problems in your T3 area. It's common. I mean, we run labs all day, every day. It's common. So what does that mean? Well, let's support the conversion. Let's bring in some natural medicines. Let's see, what's going on there, why that conversion's not happening. Let's look at the gut. Let's look at those detox markers on blood work also, right? So sometimes the thyroid isn't just about the thyroid blood work. I want to see what the liver's doing up there. Do you have fatty liver? Is it sluggish? Is your bile slow? Like, what's going on there? So then there's the next caveat. Maybe you have enough T3. Well, here's your cell and it has receptors on it. When you're stressed, and that does not just mean mental stress, it could be physical stress from having pathogens, infections, not sleeping enough, again, stress from now and stress from your past. A lot of people like to ignore their past emotional stressors that their body might still be hanging on to. You might get a high reverse T3, which means that something else is going to come and block that absorption of that T3 onto your cell. So you have enough T3 and it doesn't get into the cell either because it got blocked off due to like a stress response. So that's what I see with that high reverse T3. And then finally, I want to see your antibodies, of course. I want to know if your body's attacking its thyroid, right? If that inflammation's going on. So those are the blood markers that I want to see to paint the picture. Now, I can argue that I'm fine with just T3 and T4. I don't necessarily need to see the free T3 and what's not getting absorbed. I mean, yeah, it might tell me a little bit more like, oh, it's, that T3 didn't get into the cell because there's a high free T3 that's not attached to anything, but I can see that with the reverse T3 too. So I'm able to simplify it if I need to, but sure, if you give me the whole picture, I'm definitely happy with all those markers. So.
Yeah. And I mean, that's the thing. I mean, probably, what do we have? 8, 9 markers in a full thyroid. I'm trying to remember how many it is by number, but it's,
I'm like, we got TSH, we got T4, we got free T4, we got T3, free T3, 2 antibodies, T3 uptake, and FTI. So yeah, we're about 9.
Yeah, and we're seeing pretty much 2.
So 10. Yeah.
Right. We're seeing like pretty much 2 in a lot of labs, right? So that's what we're talking about. I've got this friend who she's got fatigue, right? And I'm like, well, yeah, okay, your TSH is okay and your T4 is okay, but how do we know what that T3 is doing? Like,
down the road. Yeah.
They haven't looked anywhere down the road. And so, yeah, that's what we would ask for. But yeah, expect the pushback, because sometimes you get it. Sometimes you get it. There's no doubt.
If I struggle to get them, you know what I mean? And I can like literally have that conversation. I might intimidate people because I'm coming to my doctor and I'm like, I know this, this, and this, and this. And they don't know this, this, and this. And they're like, I don't want these labs that I don't know how to interpret.
Yeah.
Well, I do. So just give them to me.
Right. And sometimes I go in there and I want you to run X, Y, and Z, because we can't order, regular blood requisitions that go through insurance through our certifications and our qualifications. So
Yeah.
I'm even going to doctors and I'm just saying, hey, I want you to run. My doctors hate me. It's obvious, but I asked them to run X, Y, and Z. I said, can you run X, Y, and Z? I'd like to look at that. And my PCP is pretty good. So hopefully you find somebody you can work with. If not, certainly we can find you a way to get those. So you can
Yeah.
always reach out. And then let's talk about those antibodies and also what's possibly causing those thyroid imbalances from a root cause standpoint. We've touched on it, but let's talk
Yeah.
about some of those root causes.
Yeah, absolutely. And to be clear, we can definitely order them. We have the ability to do so, but it ends up being out of pocket. So it's not like
Right.
all hope is lost. It's just sometimes, and the panel for thyroid really isn't bad. It ends up being about 100 and some bucks. Like in the grand scheme of things, if you've ever had a full lab panel, that's really not that much. So,
Right.
get the answers for yourself. It's worth investing into. But yeah, so antibodies, like we said, there's going to be a pathogen, there's going to be a leaky gut, there's going to be a immune system overdrive on some level where something's stimulating the immune system. So again, that's why we look for pathogens. We look for deep root cause infections that possibly, and we watch food and we make sure there's no cross reactivity with certain foods like we talked about, like the grains and the potatoes and the chocolate and stuff like that. So basically, when you've got those antibodies, you definitely want to dig deeper, is what I tell people. We need to look into root causes. We need to see what's going on, from an environmental standpoint, a gut standpoint, the whole body, again, because everything works together. I mean, sometimes your thyroid can be suppressed because that leptin's suppressed, and sometimes it's not even a huge deal. Leptin's very sensitive to daylight, like we talked about in the last podcast. So it's like sometimes we can just bring in certain lifestyle habits to kind of calm that inflammation. And again, inflammation is usually driven by some cascade of immune response or diet or environment too. So a lot of it just comes down to looking at the whole picture of the person and what could possibly be driving the autoimmune response there.
So if you are fortunate enough to be able to get the labs run and you're seeing those antibodies show up and they're telling you you might need medication and all that, okay, but come to one of us and see what is causing that, right? That's the key.
Yeah, even if you're on the med and I tell you, look, we're making changes, so I want you to test this like every 4 to 6 weeks, we might be able to lower that med or get you off that med eventually. And I will be 100% raw and transparent that I have looked at a lot of thyroids. So I do ultrasound for a living as well. And, they do an ultrasound of the thyroid to look for nodules and whatever. And one thing I can say is I've seen a flare. I've seen it where I can't even tell what's a nodule and what's a thyroid anymore. And I've scanned it 2 weeks later and it's a total different thyroid because we got inflammation down. So if the appearance can change that much, imagine how much your labs can change in that much once the inflammation goes down, right? So those are the kind of things I'd want to do. But no matter what part of the journey you're in, we can usually do something. But the full transparency is from all the years and all the thyroids that I've scanned, I can tell who's taking Synthroid and who isn't. Because if you've been on it for a long time, I can start to see the thyroid atrophy. Think it, your hormones are getting overrode. Your body's not seeing a need to function. That organ gets lazy. It starts to get fibrous. It starts to shrink in size. So again, I wouldn't say wait 40 years and you're like, oh, I'll just put this off for later. Like if you get on a med, like let's work on it so we can maybe get you off the med, and maybe just, be able to rely on your body. The thyroid can also regenerate a little bit. It's not as fast as the liver, but it can regenerate. So even if there is some scar tissue there, you'd be surprised what you can do with optimizing things.
Yeah, I think, we've seen it. We've seen it in a clinical setting. We have seen people able to get off of their thyroid medicines and or lower it at the least beyond.
Maybe you need T3 and not T4 because your body's not able to do that conversion or a combination of the both. So
yeah. What else can you share about your time, looking at imaging and performing biopsies of the thyroid? Is there any other findings you can share from having looked at it? I always said if I was coming back in another life, I would want to study the thyroid because I think it's fascinating, really, what all it entails.
Yeah. Imaging is a whole different ball game there. For my life, I'm like, oh gosh, not another nodule. I mean, I worked at a clinic where we measured every single one, not just the top three. We measured every single one. And sometimes there's a lot. I will say the iodine connection is huge. A lot of times we talk about the Middle East, they actually don't add iodine to their salt. So their thyroids and their goiters are humongous. So testament to, again, iodine is a great food nutrient that you want to bring in. And most of us are switching from like white salt that's ionized, like added in, to pink salt. So we're not getting that anymore either. So it's a very crucial to get it in other ways. It's essential for the thyroid, absolutely. So the thing is usually they start off by tracking the size. Once it gets over a centimeter, they want to biopsy it. We have seen connections with cysts and radiation. So you have to think now radiation is increasing in the US, right? Because radiation is not just that CAT scan you had or that X-ray you had or radioactive treatment that you might have been exposed to, but it's also microwaves and non-native EMFs and just all these things that are in our environment now. So we're going to start to see more cyst growth and more inflammation in the thyroid from the frequencies that are around our bodies all the time. But also, so they'll do this fine needle aspiration, and that's usually most doctors' starting point. Sometimes that comes back inconclusive. They don't get enough cells on that needle that they shook around. And so they'll say, oh, I don't know what to do. And so then my next advice to somebody would be to do the core biopsy, which is where they shoot a gun in and they take a chunk out. And I recently had kind of mentored somebody who was going through a very interesting situation. And I, again, was floored. I was like, what are they doing? So they did a fine needle biopsy. It said inconclusive. Well, then there's some other way that they can test it, the inconclusive cells, or they can test those inconclusive cells in a different way. And they're like, oh, yeah, these might be cancerous. I looked at like the positivity rate of the test. Like you can get false positives and you can get true positive. You know, like there's all these different ways of looking at labs. It was like 50-50. I said, so tell me what more you know. So they're trying to say it's cancerous, but you have a 50-50 chance that that test is wrong. Like that's a false positive. So you don't know anything more than you did before you did the biopsy. And they were going to take out her entire thyroid because they were suspect it was cancer because there was now a 60% chance in their book, but not if that test isn't very effective. And I don't know how the heck you test cells that are not, like you couldn't find the cells enough to, like, it just blows my mind. So I said, listen, your thyroid is a crucial organ. I said, it does not hurt to get a second opinion. I would ask for that core biopsy. They're like, well, they said that would cause tracking. I said, you don't think that needle that came in and stirred up all those cells and then drug out didn't track cells out? I'm like, you already broke the capsule. You might as well go and just take a whole chunk of it out and get a real test. And I said, and even then, I said, if they want to remove half a gland, I'm fine with that, I guess. I mean, if we're going to really err on the side of caution, because you can have a gland and a half and function pretty well. But to take out the entire thyroid off of the odds that woman had just absolutely infuriated me. So you really have to be your own advocate. It's really good to have somebody standing in your corner because sometimes I don't know where the medical world comes up with some of these things. And again, it's an important organ. You know, every organ in the body has a purpose for sure. And yes, you can optimize when you're on thyroid meds and your whole thyroid is gone. Like it's not too late. Again, those nutrients that we talked about are just as crucial for your thyroid medication to work, right? So you can still support it even on meds, but if you can avoid have it, take it out, and you can be proactive in that sense, I would love to see that for a lot of people. So thyroid cancer generally is not too aggressive. You know what I mean? A lot of times you worry about cancer spreading to other points in the body. I saw a 90-year-old woman with cancer, and they were taking her thyroid out. I'm like, dude, she's going to die from something else. She's going to die from old age. It's not usually aggressive. And if it is aggressive, it's usually one nodule on the whole thyroid. It's uninodular. When you have a multinodular goiter, your chances actually of cancer go down.
Yeah, and I think I have a rule. You're not going to remove something from my body or add something that doesn't belong there unless I have multiple opinions. That's
a conclusive answer. You know, like,
yeah,
I had a nodule on my nose and they wanted to cut this big scar and leave me with like a Harry Potter scar because my mom had cancer. So they were just going to assume that I had cancer. I said, let's biopsy it. Now I paid for that. It was like getting punched in the nose because it was the shotgun biopsy. Like I talked about, the core biopsy, but it almost took out the whole nodule and it hasn't grown back and it wasn't cancerous. So I would have been ticked if they had this whole scar on my face and it wasn't even cancerous.
Yeah, so the bottom line is there, let's get another opinion when things like that happen, and that if it has been removed, we can optimize, right? If it has been removed.
Absolutely. Yeah. Yep.
What are the implications of an undiagnosed thyroid issue?
obviously it's going to get worse. I mean, the tissue is going to continue to, have nodules, or it's going to continue to be inflamed. It's like it can progressively get worse for sure. So it is nice to catch it early on, but like I said, it is an organ that's somewhat forgiving if it can regenerate. So with a little bit of love, sometimes we can get a long way, even if there are nodules. Like I said, I have a little bit of scar tissue that I can see on mine, and I can optimize things just fine. So, yeah.
Someone's listening to this. I know
Mhm.
it's hard, right? Because we don't know. Let's just say they're having some kind of thyroid dysfunction and issues. What are some actionable steps to take right now? Step 1, step 2, step 3?
Yeah, diet first. I mean, right? Because we can get so far with food. And I always want to take the like lowest hanging fruit. What's cheaper? Like, what can we work on? So, supporting those nutrients that we talked about earlier in the podcast, supporting the gut, your detox pathways. I mean, just think about it, guys. We live in a toxic world. We touch things every day. There's chemicals in our shampoo, our makeup, all day with the water we drink. So, like, throw on a castor pack, support that liver sometimes. They're just really cheap things you can do and see where you can get. Maybe a probiotic for the gut, let's just keep it simple. And maybe some periodic testing so you can get an idea, like, is this a snapshot in time or is this a pattern? Because that's what makes a difference in your next step. And again, I don't think it ever hurts to take the desiccated animal-based supplement. You've got Heart and Soil, you have ancestral supplements. I don't care which one you pick. But bring in food medicine, bring in the nutrients that your thyroid needs to see where you can get first. And, then if you're not noticing the symptom improve, reach out to somebody and see, like, is this actually my thyroid or is this something else? Because again, a lot of these symptoms cross over into other areas too, right? Like heart palpitations can be nervous system dysregulation from a different pathogen. It's not always your thyroid. But it is a good place to look at because it is a common disease. I mean, back to how you said, like, it's more common in women. It's like 5 to 8 times more likely for women to develop thyroid disorders than men.
But men can have thyroid disorders.
They
That's
can.
the thing. So
Mhm.
for a male, let's just go into that because we didn't touch on that. We need to touch on that.
Yeah.
Males can have thyroid issues. So what is a sign for a male? Like, hey, wake up tomorrow morning and guys, let's do a check here. Let's see, make sure that you're also supporting thyroid.
Yeah. Funny, male or female, a lot of the checks that you're going to do are the same, right? So you know where the gland's at, and you can kind of get used to what your neck feels like, just like a breast exam, right? Like, your normal tissue, you feel around. Does anything feel different, right? Does that feel bigger? So get to know your thyroid from like a touch standpoint. So that way, if you're like, maybe I'm swallowing a little harder, like maybe you'll be like, oh, well, that also feels bigger because your esophagus runs right down there, right? So a common symptom of hypothyroidism also is people not liking things on their neck, like not liking turtlenecks, not liking scarves, like they feel a funny sensation there. Obviously, with the hyper, some people get the bulging eyes, and the heart palpitations are going to be some of the first signs. Your body temperature. You can wake up tomorrow and get your basal rate, right, which is the temperature when you wake up. If you always tend to run a little lower in temperature, you could have a thyroid problem. And that's a real easy way just to check. And if you're running higher, you could be in hyper, so they say. I have not yet seen that one firsthand, but I know myself and my thyroid, I definitely was running lower temperature in the morning than I should have been for a while. That should have alerted me to maybe, pursue supporting that organ sooner.
Yeah, and I want everyone to know, these podcasts that we do, we touch on a lot of the same things, right? We're talking about toxins, we're talking about replenishing nutrients, we're talking about the gut quite a bit because everything starts there. We're not trying to fearmonger anyone. We're talking about this because we are at a time when we have to, because there is no choice anymore with the amount of things we are exposed to. We have to do something. Doing nothing is no longer an option. And so this is why we're talking about these things with you all. And so if you need functional tests run and you want to see what root causes are, chances are you might not get that from your 99.9% sure not going to get that from Western medicine. And that's where we come in to help. And Kelly, people can reach out to you for help. Thyroid is a area that you have definitely specialization in. So how can people reach out to you if they need help in these areas?
Usually Instagram is my most common hub. That's where I'm at the most often. I broke down, I made a TikTok. It's not one of my most glorious moments. I'm not a fan of TikTok myself. I'm not a real person, but I'm trying to reach more people. So sometimes you do what you got to do, because obviously I got into this to help other people. I mean, I was sick myself and modern medicine didn't help me. And I worked in modern medicine, which was the most frustrating part, like I couldn't even have conversations with my peers, like, so, yeah. And I have a website as well. I got that up and running. So I'm sure Christy will put that in the show notes as well, too. So.
Yeah, and I hope you'll come back and discuss more. I think you and I have a couple of other topics that we want to hit on, so I know you'll be back. So thanks for joining as always.
Yeah, absolutely a pleasure. I'm sure this could have been an hour and a half. I mean, the thyroid is very, very complex. So, I mean, if anyone has questions afterwards, I will watch when Christy puts this on Instagram and try to answer any of your questions too. So,
Awesome. Thank you, Kelly.
all right. Thanks, Christy.